Welcome to Trauma Informed Vaccine Conversations with the Washington State Department of Health. Today I'm joined by clinical psychologists Dr. Kira Massa, Dr. Tona McGuire, and Dr. Michelle Andrasik for a discussion about trauma informed vaccine conversations during the COVID 19 pandemic. Dr. McGuire, people are coming in for vaccines with all different backgrounds and experiences. What are some strategies and tools providers should use when working with pediatric patients? How can these approaches lead to better patient outcomes?
I think the approach is the same. It's a matter of being sensitive and planful and kind of respectful of a child's space. It's really important with little children that you approach them gradually. Sometimes starting, if you have to touch them and you don't, and they don't have a choice about being touched, just explaining what you're doing. These are your feet. And so kind of working your way up if you have time to do that. And now these are your knees. Um, Providing an explanation about what comes next is really helpful for children. So I'm going to be putting something on your arm and it's going to feel cold. Just so they know kind of, and what comes next is then we're going to go ahead and do the vaccination, and you're going to feel a little pinch or whatever terminology the provider likes to use, just so the kid has a sense of this is what comes next, and this is what I can plan for. And then making it quick. Anxious children and children who've been through trauma will often try to defer things by asking a lot of questions, and we fall into that, answering the questions. But the longer they delay the inevitable, and most children will have had plenty of shots in their lifetime, the more their anxiety goes up. So information, planning and preparation, being gentle about touch, and then being quick so that the child isn't allowed to kind of ratchet up their anxiety as they're getting ready to have this uncomfortable procedure.